Next, May is National Stroke Awareness Month, so I talked with Dr. Andrew Ehrhard, Medical Director for the Emergency Department at Northern Light Easter May Medical Center, about the warning signs commonly known as FAST. So, Andrew, May is National Stroke Awareness Month. What is a stroke?
A stroke is when an artery that supplies oxygen and nutrients to the brain, for some reason, doesn't supply the necessary amount of blood to certain parts of the brain. This can result in symptoms and even brain damage and tissue death.
And what causes it? Is it always caused by a spike in blood pressure, or what causes it?
It's caused by two main events. One is where a blockage actually occurs in the artery. That is roughly 90% of the cases of stroke. And then the other 10% is when the artery actually ruptures and bleeds into the brain.
Okay. And is this something that can be hereditary? If you have a family member that had stroke, are you more in danger of stroke?
Yes, so there are many different reasons to increase your risk of stroke. It can be hypertension, obesity, high cholesterol, smoking, diabetes, atrial fibrillation, genetics are just a few. Those are the main ones.
Okay. All right. My mom had a hemorrhagic stroke several years ago. My dad got her to the hospital immediately. She has no lasting effects, which I know is highly unusual. Effects of a stroke really can vary, can't they? They can be mild to pretty severe.
Correct. Stroke symptoms can run across an entire spectrum. They can be quite serious, involving paralysis on one side, inability to speak, even death. Some people have symptoms that are less severe than that, and they can physically walk out of the hospital and still have their normal activities of daily living. And some people can have symptoms that resolve, and those are commonly called TIAs or mini strokes.
So what is a TIA?
A TIA is called transient ischemic attack, which is a set of symptoms that can vary: speech difficulty, facial droop, arm or leg numbness or weakness, basically all the symptoms that we said with the FAST, F-A-S-T, signs and symptoms. They get better on their own. Okay. Sometimes they only last 15 minutes, sometimes they can last an hour, sometimes they can last up to a day, but they go away without any lasting brain damage.
Wow. Okay, so say I have a TIA and I get better, what are my chances of getting a stroke at that point?
If you do have a TIA or a mini stroke, you should still be evaluated as fast as possible, even calling 911 to come to the emergency department. The reason for this is roughly 15% of all people that have a TIA can have an actual stroke within the next 90 days. So it's important to get seen, evaluated, and receive any testing that you need to ensure that you don't actually develop that stroke in the next 90 days.
Okay. And if you don't have a stroke in the next 90 days, is it still a warning sign that you could be prone to stroke or at risk of stroke?
It depends on if you received your testing or not. If you receive the proper testing and everything checks out, then you should feel more confident that you won't have a stroke in the near future. Okay. However, if you just ignored it and crossed your fingers, then you are at a higher risk of having a stroke even after 90 days.
Okay. All right. Right. So what are the warning signs of stroke? I know you have an acronym, FAST. What is FAST?
Yeah, FAST is capital F, capital A, capital S, capital T, FAST. And it's facial droop for F. A is arms, so arm weakness or arm numbness. S is speech, so slurred speech. And T is time to call 911. Those are the symptoms that we ask the public to look for the most. There are other symptoms as well. If you have sudden headache, that's the worst headache of your life. If you have lack of coordination or vision or balance or dizziness that comes on suddenly, that can be a different type of stroke that people aren't as familiar with. Confusion is another one. So there are a gamut of different symptoms, but FAST is the big one we want people to think about.
So if someone that you're with, a side of their face starts drooping or their speech becomes slurred or they seem very confused, you call the ambulance immediately, correct?
Correct. We don't recommend that you drive yourself to the hospital. This is for a couple reasons. First is ambulance crew are trained professionals, and so they can help you with any emergency that you have right there in the ambulance. The other reason is they can call ahead to the hospital to let us know you're coming so we can prepare and get ready for a patient that possibly is having a stroke. If you just show up to the front door of the emergency department, we obviously will see you as soon as you get there, but it'll both take us by surprise, and if there was something that happened to you in the car, no one was in the car to help treat you.
Right. The last thing you want to do is be behind the wheel.
Correct.
Minutes really count when it comes to a stroke.
Correct. Time counts with a stroke. The sooner you can get to the emergency department, the better to be evaluated. There are certain medications and therapies we can give that are time dependent, and the sooner we give them, the better. So it is not beneficial to you to sit and wait and hope that things get better, because that can affect how beneficial our medications are that we give you.
Right. And my face is drooping. Let's wait an hour and see what happens. Probably not a good idea.
No, absolutely not.
Yeah. Okay. Okay, so don't drive yourself. If you call an ambulance, what happens in the back of the ambulance on the way to the hospital?
So the medical personnel in the ambulance do a variety of different things. They check your vital signs. Sometimes people can have a stroke or stroke-like symptoms from high blood pressure. They can help treat that. Sometimes people have stroke or stroke-like symptoms from low blood sugar, and that's diagnosed with just a simple finger stick, and they can start treating that right in the ambulance.
Okay.
Sometimes people can actually have heart problems, like a heart attack or a heart rhythm problem, that are just giving the patient symptoms of the stroke, but it's not really their brain, it's their heart.
Okay.
There's a multitude of different tests that the ambulance could do. In addition, if someone's having a stroke and they're getting worse, the ambulance could even assist breathing if necessary, or even put in the breathing tube and put you on a ventilator if necessary, or in worst case scenario, if you stop breathing and your heart stops, the ambulance would start CPR. So there are many different things that the ambulance can do that you're never going to be able to do in a car.
Right. And a stroke can be fatal, correct?
Correct. So roughly 800,000 Americans per year have a stroke. And of those 800,000, roughly 140,000 Americans die per year of stroke. It's actually the fifth leading cause of death in the United States.
Wow. Wow. So worth it, whether it's in your family or not, I would think, to familiarize yourself with the symptoms. So if you see someone starting in that direction, you know what to look for.
Absolutely. We are happy to see everyone that has stroke-like symptoms, and we're equally happy when they don't actually have a stroke, and we say false alarm, or thank you for coming in, or good news, you're not having a stroke. That's great when people come in to be evaluated.
Right. So in our current health climate, I'm guessing that there are a lot of people who are afraid to go to the hospital. What do you say to these folks?
If you think you're having a stroke or a heart attack or any serious medical problem, you should still call 911 and you should still come to the emergency department. I understand that people don't want to come in out of fear and respect for COVID-19, and that certainly is understandable. But if it's something as serious as a stroke or a heart attack, you still need to call 911 and you still need to come in. Don't wait. And
I'm sure you folks are doing everything you possibly can to keep things as sanitized as possible and protect your patients.
Correct. Our emergency department, we have different areas for the different types of patients, whether we suspect they have COVID-19 or not, and we use the proper PPE that everyone's been talking about appropriately, and we test people that need to be appropriately tested. So we're doing everything we can to keep the patients and their families safe when they come to the emergency department.
Okay. And finally, is there a website where people can get more information about stroke and the warning signs?
There are many different websites that you can get information from. One would be www.stroke.org. Another great one is cdc.gov/stroke. Those are both fantastic websites. Northern Light Eastern Maine Medical Center also has a stroke support group run by our stroke service. That telephone number is 973-8278, and they can give a lot of information as well.
Okay. Again, FAST stands for facial drooping, arm weakness, slurred speech, and time to call 911 if you see someone with these symptoms. As Dr. Ehrhard said, you can find more information at stroke.org, cdc.gov/stroke, or call the Northern Light Eastern Maine Medical Center Stroke Support Group at 973-8278.